Right on, guys. Well, I haven't done a video for a little while now. I did promise an update after my botox, and I suppose this is going to be it, really. Um, from my last video, I had botox injections, 100 units in 10 sites across the bladder and 4 in the trigon on the 17th of February this year. Prior to that, I had been on 10 mils of amitriptyline, and Professor Hashim had upped that to 20 mils a day before my botox. I think I mentioned I had a bad flare the day of the Botox, and I can't remember what point I was when I did the video last. So, Botox kicked in about day 7. The urgency disappeared, which was fantastic, really, because I've had over 2 years now of abnormal bladder sensations, and to suddenly not have them was, quite amazing. You think, oh, I need a pee, and then half an hour later, you think, oh, I still need a pee. And this was pushing like 3/4 of an hour, and that urgency, I got to go now, just disappeared. So I think, wow, this Botox is working really well, but unfortunately, it didn't last that long. I think 3 to 4 weeks was the best I got out of it, which would have been something like week 5 post Botox. Um, it didn't. No, it's wearing off. It didn't happen overnight. Suddenly, thought, that urgency's a bit come back a little bit. It's only been now and again. It's getting to the point now. I had another flare this morning, and the urgency is very bad again. Certainly during a flare. I'm a trip lane. I went back and saw Mr. Hodgson up at Dutchy Hospital there last week. We had a bit of review about going forward. He's going to slot me in as soon as he can for 300 units of Botox across 15 sites on the bladder. We've agreed to continue on the general anaesthetic. Given my bladder inflammation and the extreme external skin sensitivity I seem to have developed from one of my tablets. I had a tattoo on my arm this time last year. I had no problems this year. I've gone for a similar size tattoo, and the pain after half an hour was unbearable. I had to end up using Elna cream prior, which is 5% lidocaine, which is obviously quite a bit more than the Instilla gel. To soothe it, and that allowed me to sit for about 3 hours. So I said, given how the external skin is feeling and the inflammation in my bladder, there was no way in hell I was going to have Botox done under local anaesthetic, which Mr. Hodgson agreed, and that was fine. In terms of the amitriptyline hasn't done a lot. There's been peaks in the capacity on dose increases for about 24, 48 hours. Our peaks sort of like 265, 285 during the day, 360 to 400 mils overnight. The side effects come end up were getting absolutely horrendous. I probably persevered on the amitriptyline more than what most would have done. It made it difficult. It made it hard to pee when I first started on it. I think I mentioned that in the last video. Funny as the doses went up, this doesn't seem to get any worse, but it doesn't get any easier either. I've been cathing pretty much every toilet trip for the last 2 weeks because even sitting down, it just got that hard to pee. I thought I can't be dealing with this. I have plenty of casts there, so I'm cathing all the time. I've settled into doing that all right. If I had to do it for the rest of my life, it's not going to be the end of the world. It's not. Sometimes it's not particularly convenient. Certainly, if you're breaking your neck for a pee, I think I've got to wash my hands, take the cath out, and clean everything. And you can't just sort of flop your cock out and go for a pee. Quite often, I go to the toilet still expecting to do that. Force a habit after 35 years. Unfortunately, those habits are hard to lose. Anyway, so side effects for the amitriptyline seem to be some that aren't even listed on any list I've seen. The Mayo Clinic one is the most extensive list of amitriptyline side effects. So I had the usual severe dry mouth, day and night, which drives you absolutely mad. Certainly when you wake up during the night, feeling like you've been sucking on a piece of leather, there's no moisture in your mouth whatsoever. Obviously, there's difficulty in peeing, which is a common side effect. I apologise for the in-depth mentions on air if my mum or my sisters are watching this. Unfortunately, this is what you get from my videos. So I had super intense hard-ons, which my wife found a bit uncomfortable. I had orgasms that were really that intense and literally take your breath away, tenses the body up that bad. It's almost like dry retching when you're being sick and you can't bring nothing up. Your whole body tenses up. You can't breathe. You can't talk. You can't do nothing. It sort of wasn't what I would call a pleasant experience, not an enjoyable experience. And it's really worse than my delayed ejaculation to the point that sort of 60 minutes, you think I just will give up because nothing's going to happen. You get to that plateau stage and you can't get over the top. And then the day before I went back to see Mr. Hodgson, I had severe heart palpitations for about 15-20 minutes. Unloading the van one morning, and they did disappear, luckily. Went and saw the doctor, he ran the ECG, and we're happy there was nothing wrong with my heart. They'd done some blood tests, but I haven't heard back the results. There couldn't be nothing wrong there. And both my doctor and Mr. Hodgson agreed that it's time to start weaning off the amitriptyline. So I'm now spent a week on 50 mils from 75, and now a week on 25 mils. And I'll do another week on 25 mils every other day, which will cut that down to about 12 and a half. I don't seem to have had too many side effects, withdrawal symptoms coming down off it. Say probably no worse than when I went up on the amitriptyline. And cap it all, the amitriptyline did nothing for the sensory urgency, which was the reason Professor Hashim prescribed it in the first place. So really, it's just been a wasted job. It's just been a bad job, really. I had another chat with Mr. Hodgson over the IRL installations, and again, he felt that really, given my symptoms, I wasn't going to benefit from them. So to say, wasting my time and clinic time, and NHS resources, we've agreed not to really pursue the IRL installations. So unfortunately, the way things are going, it's all heading towards surgery. Really, I think that is it's inevitable now. Really, we'll see what the 300 units of Botox does. Hopefully, it will last at least 12 weeks. I did quiz Mr. Hodgson on this. 300 units inside of 12 weeks rule, and he said when I was, if it's wearing off, he said we can cut it back a little bit. So if it only lasted 10 weeks, time you got sorted in again, you would probably be the 12-week mark. Hopefully, it will last at least 12 weeks. It really wants to last a good 12 weeks. And then we'll review the situation, probably going to be late July, early August. And I'm 99% sure, really, the only way forward to help my capacity is going to be augmentation surgery, unless Professor Hashim agrees on any other invasive surgery. Really, I was hoping that a couple of times that the amitriptyline was going to sort me out. The Botox got rid of the sensory urgency, it did nothing with the capacity. No, I can hold off a little bit, but you can't hold off hours no more than a normal person would. So I could hold off till it was convenient. So if I was on the road, I think, oh, I need to pee, I wouldn't have to pull in quick and go. That isn't quite so easy now. In fact, I'm on the cath. You can't just pull up the side of the road and go beside the van. You've got to go in the van, which means you've got to be parked up somewhere safe and shut the engine off, take the key out, and so it just gets even more inconvenient. So I'm driving anywhere. I like to think, if go for a pee before I leave to make sure I don't get partway along the journey and need to go for a pee. Now I'm on the cath. So at the moment, that's about where we stand, really, in terms of updates. For those who watch my videos, we'll do another update. I don't know, maybe after the Botox, they're going to do another gentle hydrodistension. My capacity does improve marginally after the hydrodistension. It is slipping back quietly now. Now we're sort of approaching the 10-week mark post hydrodistension. It does, capacities day and night start slipping back. It would only ever drop so far if it was 6 or 8 months between hydrodistensions, but the more often I can have them done seems to keep me at sort of like a 200 ml daytime and 300 ml nighttime. I did another bladder diary before I went and saw Mr. Hodgson, and he said, "Oh, your results are looking a bit better." And I said, "Be aware," I said, "those are cath figures, not not figures peeing normally, um, well, with residue sort of thing. And when you take into account that there's going to be at least 40 to 50 mil residue if you pee normally, the figures aren't that good, really. They're certainly no better than they were this time last December." Oh, so we're gonna have to wait and see. Hopefully the Botox will help with the sensory urgency again, which is a big part of it. But the amitriptyline did nothing more than ruin my quality of life as opposed to improve it. And Mr. Hodgson really asked. He did state a very valid question. Really, he said, "What would you rather improve, the capacity or the urgency?" And and did the Botox improve your quality of life? I think all the way along, really, the importance of your quality of life is utmost. Like everything, the Euros, both Mr. Hodgson and Professor Hashem, who's a pelvic surgeon, none of them want to do unnecessary surgery or invasive surgery or cost the NHS more money. But when it comes down to it, my quality of life is really what matters at the end of the day. Whether they would prefer not to do a surgery to do a surgery, treatments such as the botox and one thing or another is what helps improve my quality of life. And although my quality of life is marginally better now than it was 18 months ago, is still nowhere near where it was before I had my initial IC attack. And with the amitriptyline, it has worsened my quality of life to a point. Now I'm coming down off it. It is leveling back to what it was pre-amitriptyline levels. And I think this is what you've always got to remember if you're not, if you're an IC sufferer like me, or you suffer with overactive bladder or prostate problems, whatever it is that quality of life, and that's what needs to be impressed all the time. Because some neurosurgeons may palm off, oh well, no, it's going to cost too much, or it's unnecessary, or but end of the day, if I can have surgery and it will vastly improve my quality of life, even though my life going forward is going to be very different from the one I lead now. Right, I'll still have the cath, but the complications and the problems that can come with augmentation, the extra things you have to do, such as bladder flush outs every day and such like, and supplements because you can't know they've taken a piece of your bowel out, and it's no, if it improves my quality of life significantly for what it is at the moment, and I think that's what matters at the end of the day. I don't particularly want invasive surgery, not when I'm sort of looking at 8 to 12 weeks maybe to recover from the surgery. It could be longer than that. They state 6 to 8 weeks online, which I think is particularly optimistic for someone in the trade, somebody who does hard, heavy lifting all the time. I think 6 to 8 weeks is awfully optimistic to 90% baseline. So I said it's not going to be an easy trek or an easy transition. But I think if at the end of it I can go back and say yes, I've got a good bladder capacity. I only have to cath 3 or 4 times a day as opposed to 10, which at the moment is ranging between 8 and 10 times a day per 24 hours. Recently, I've been getting up during the night for a pee, which has been frustrating as well. You're getting up 1:30, 2:30 during the night, you're half asleep, and you're trying to cath as well, which is not ideal. I don't mind sort of a bit nearer to 5 to 6 o'clock when I get nearer to when I get up. Your body's sort of getting to the point it wants to wake up. Like mornings now, it's that much easier, that much more awake when you get up, and it does seem to have settled again. So I think it's part and parcel of the amitriptyline wearing off, and hopefully after the amitriptyline has left my system, things will settle down to at least what they were pre-amitriptyline. Yeah, so I'll catch up with you again in a few weeks, guys, and we'll see how we go from there. Right on. Cheers and bye.